Across Canada, a troubling trend is emerging. Tent cities, once a rare sight, are becoming increasingly common. Major cities like Toronto, Vancouver, and Montreal are grappling with this issue. Smaller towns and cities are also seeing encampments spring up. This visible sign of homelessness points to a deeper crisis. The lack of affordable housing is reaching a breaking point. The numbers are alarming. Estimates suggest that over 35,000 Canadians experience homelessness every night. The actual number is likely much higher. Unsheltered homelessness, as seen in tent cities, has increased dramatically in recent years. The COVID-19 pandemic exacerbated the situation. Lockdowns and social distancing measures reduced shelter capacity. This pushed more vulnerable people onto the streets. The rise of tent cities is a complex issue with no easy solutions. It is a stark reminder of the growing inequality in Canada. While some enjoy prosperity, others are struggling to survive. The lack of affordable housing is a major driver of this crisis. Soaring rents and stagnant wages are making it impossible for many to afford a place to live. At the heart of the tent city crisis lies a severe housing crisis. Canada is facing a critical shortage of affordable housing. The cost of renting or owning a home has skyrocketed in recent years. Wages have not kept pace with these rising costs. This has made it increasingly difficult for low-income individuals and families to find affordable housing. The situation is particularly dire in major cities like Toronto and Vancouver. Here, the average rent for a one-bedroom apartment can easily exceed $2,000 per month. This is simply out of reach for many people, including those working full-time. The lack of affordable housing options leaves many with nowhere to go but the streets. Several factors have contributed to this housing crisis. One factor is the financialization of housing. Investors, including large corporations, are buying up properties and treating them as investment assets rather than homes. This drives up prices and reduces the availability of affordable units. Another contributing factor is the lack of government investment in social housing. For decades, successive governments have underfunded or neglected social housing programs. This has resulted in a significant shortage of subsidized housing units available to those in need. Life in a tent city is harsh and precarious. Residents face numerous challenges daily, including exposure to the elements, lack of sanitation, and increased risk of illness. These encampments often lack basic amenities such as running water, toilets, and garbage disposal. This creates unsanitary living conditions that can lead to the spread of disease. Beyond the physical challenges, tent city residents also face significant social stigma and discrimination. They are often stereotyped as lazy, drug-addicted, or mentally ill. This stigma can make it difficult for them to access services, find employment, and reintegrate into society. The mental health toll of living in a tent city is immense. The constant stress, uncertainty, and lack of privacy can exacerbate existing mental health conditions and lead to new ones. Rates of depression, anxiety, and substance abuse are significantly higher among homeless populations. Furthermore, tent city residents are highly vulnerable to victimization. They may be targets of theft, violence, or exploitation. The lack of secure shelter makes them particularly susceptible to these dangers. Women, LGBTQ2S+ individuals, and Indigenous people are at even greater risk of experiencing violence and abuse while homeless. Addressing the complex issue of tent cities requires a multifaceted approach that tackles both the immediate needs of those experiencing homelessness and the systemic factors that contribute to it. Governments, communities, and individuals must work together to create long-term solutions. One crucial step is to increase the supply of affordable housing. This requires significant investment from all levels of government in the construction of new social housing units. It also necessitates policies that encourage the development of affordable rental housing, such as inclusionary zoning regulations that mandate a certain percentage of affordable units in new developments. In addition to increasing the supply of affordable housing, it is essential to address the root causes of homelessness. This includes poverty, mental health, and substance abuse. Expanding access to affordable health care, mental health services, and addiction treatment programs is crucial. Another important step is to provide adequate support services to those living in tent cities. This includes access to food, water, sanitation facilities, and health care. Mobile health clinics, outreach workers, and peer support programs can play a vital role in connecting residents with essential services. Advocacy groups and community organizations are on the front lines of this crisis. They are providing essential services, raising awareness, and advocating for policy changes. These groups are calling for a human rights-based approach to homelessness that recognizes the dignity and rights of all people. The rise of tent cities in Canada is a stark reminder of the challenges we face as a society. It is a call to action to address the root causes of homelessness and create a more just and equitable society where everyone has a safe and affordable place to call home.